without them. You've heard of federal health care reform, but now a group of state lawmakers says Texas can do it better.
It's called an insurance exchange, and as one lawmaker put it, it's the Travelocity of health care. But this idea for the state might not make it through the session, and our political reporter, Josh Hinkle, is here to tell us how it would all work.
Well, here's the idea. By 2014, the federal health care reform requires states to set up an insurance exchange where people or small businesses can get coverage from a big competitive group of insurers. If states don't, then the federal government will, something the bill's author says might not be in the best interest of Texans. Beyond dipping into the rainy day fund and begging lawmakers to pull back on Medicaid cuts.
When we first heard that Texas is considering reducing the deficit by cutting back on Medicaid, we were literally sickened.
An insurance exchange might be another option to help with Texas' health care crisis.
It connects people with the appropriate plan and price for their needs, just like Travelocity. And it helps people shop for the best product.
On KXAN's upcoming Session 11 program, Democratic Representative Garnet Coleman joined his Republican colleague John Zerwas in touting a bill to drive coverage costs down.
That makes the market more competitive immediately because everybody says, uh-oh, now there's somebody who's telling them the difference between all these plans, and they say, oh, this one really works for me and it's less expensive, and then the other person has to drop their price.
Supporters say even if the federal health care reform can't survive future battles in Congress and the Supreme Court, the idea of a statewide system to find the best low-cost provider for each person is still a good one.
I want Texas to be, in the driver's seat with regard to its health insurance, and specifically this health insurance exchange is kind of that piece of the puzzle.
If we don't pass a health exchange bill in Texas, then we're going to leave it to the federal government to have to design one for us.
With so many Texans and so little funding, those lawmakers say an insurance exchange might be the option the state can't afford to lose. Representative Zerwas says the statewide exchange would cost a few million at first, but federal funds could cover about 90% of that. It would need to be up and running by 2013, so it would have a pilot program next year. But the biggest hurdle will be Governor Perry. His office doesn't comment on potential vetoes, but State Representative Zerwas says he's been told the governor doesn't support the idea. You can watch his debate with Representative Coleman on health care this Sunday morning at 9:30 on our Session 11 program. In the studio, Josh Hinkle, KXAN.